Hello, how long do you want to live? Preventable diseases here in America and around the world are extreme, and you can do something to avoid them. Did you know the top 5 leading causes of death in the US are heart disease, cancer, chronic lower respiratory diseases, stroke, and unintentional type injuries? This accounts for 63% of deaths in the United States in 2010, according to CDC. I will not read all of the statistics on the screen, but did you know it's possible to prevent large percentages of premature deaths, which are people dying before the age of 80? Do you want to live longer than age of 80? Think about it. By preventing the premature deaths just for heart disease, this could prolong 92,000 lives. Dr. Tom Frieden, Director of Nation's Public Health, reports that more than 100,000 premature deaths each year are preventable. Look at the common risk associated with each chronic disease. These are all things that can be controlled by you. Tobacco, high blood pressure, high cholesterol, type 2 diabetes, poor weight, being overweight, lack of physical activity, sun exposure, and alcohol. And even the risk associated with unintentional injuries, like not using your seatbelt or motorcycle helmet, purchasing of consumer products that are unsafe. Again, we see drug and alcohol use, exposure to occupational hazards, and unsafe home and community environments. Many of these risks could be avoided by making changes in your personal behavior. Look at the major causes of death worldwide. The following continue to be top major killers through the past decade. The World Health Organization reports over 7.4 million deaths occurred for ischemic heart disease, stroke, 6.5 million, lower respiratory infections, 3.1, and the same for chronic obstructive lung disease. The World Health Organization also reports that heart disease and stroke are on the rise. However, diarrheal diseases, HIV, and lower respiratory infections have decreased slightly. It is important to look at chronic diseases and the number of deaths that vary based on countries' income status, demonstrating the country's financial ability to address preventive care. Take a look. Notice lower income countries have a higher death rate for lower respiratory infection, HIV, and diarrheal diseases. However, higher income countries have been able to successfully address and lower their death rates for these diseases. I think it's also interesting just to mention, in our high income countries, 1 in every 100 deaths are among children under the age of 15, but in lower income countries, 4 in every 10 deaths are under the age of 15. Cardiovascular disease, your heart. This continues to be the #1 cause of deaths across the world. However, look at the risks. Again, it's tobacco use, poor diet, overweight, lack of physical activity. These are behavior modifications that you can control. We need to understand the statistics and the cause of death in America because it leads to more preventative measures. Did you know more than 75% of our healthcare spend in the U.S. is on people with chronic conditions? In 2005, 133 million Americans, almost 1 in every 2 adults, had at least one chronic illness. And we all believe that if we spend, at least, I say all, but 84% of us for sure, favor public funding for such preventative programs. Think about it. Teaching our children healthy behaviors and practices when they're in school is far more cost-effective than waiting until unhealthy behaviors are entrenched and they later in life have a chronic disease. Another good example is the regular screening for colorectal cancer. When it's found early and treated, the 5-year relative survival rate is 90%. The power of prevention. We see tobacco in all of our risk factors. So important that we stop smoking. In 2 to 3 months after quitting, your heart risk begins to drop and lung function begins to improve. After a year, the risk for heart disease is reduced in half. And after 15 years, the risk is similar to the same as a lifelong non-smoker. Look at improving diet and exercise. A 5 to 7% maintained weight loss in at least 150 minutes a week can prevent or delay the onset of type 2 diabetes for Americans at high risk for the disease. It's time to consider your wellness, but you must first understand the 7 dimensions of wellness. Physical. You need to be physically fit. The use of your body and what you eat. Everything that affects your physical body is your physical wellness. Intellectual. Use of your mind. Do you read the newspaper? Do you go to museums? Are you keeping yourself intellectually healthy? Are you reading? Are you writing? Emotional. Consider emotional. Are you happy? Do you have the ability to laugh? Are you enjoying your life? How do you cope? That's your emotional wellness. Your social is the ability to get along well with others, working well with others, being in social conditions. Spiritual. Spiritual is the personal search for meaning and direction in life. Some people often refer to spiritual as their connection with a god or another entity. And that's part of it, but it's about you and what you find spiritual. Where are you going? What is your direction in life? Are you spiritually healthy? And your environment. That's the preservation of natural resources as well as external rewards you value. Do you get enough money for your job that you do every day? Is where you live healthy and safe? Consider occupational, deriving personal satisfaction from your vocation. Are you happy with your job? Are you happy with what you do every day? Because we spend more time at work than we spend at home. It's important that you have occupational health as well. These are all 7 dimensions of our health and wellness working together to produce a new and healthier you. Your physical, intellectual, emotional, social, spiritual, environmental, and occupational. They all are parts of the puzzle that give us complete wellness in all 7 dimensions. Look at the top 10 list, lifestyle practices that enhance your wellness. Consider how many of these habits do you practice? Do you exercise aerobically at least 4 to 5 times a week? Have you eliminated tobacco products from your life? Limit animal fats, cholesterol, and other fats from your diet. Are you eating at least 5 to 9 daily servings of fruits and vegetables, and including other high-fiber foods and whole grains in your diet every single day? Assess your personal stressors and practice stress management techniques, including maintaining a strong social support system. Limit your consumption of alcohol to no more than 1 drink for women or 2 drinks for men every day. Pursue and maintain a healthy weight. Fasten your seatbelts, wear those helmets, and practice safer sex habits. Balance work, social, and personal time, including getting 7 to 9 hours of sleep every night. These practices will lead to enhanced wellness in your life and prevent you from becoming one of the Americans that have a chronic disease. Are you ready? We're ready to support you. We offer to our employees smoking cessation classes, Weight Watchers at work, stress management seminars, health educators, care managers, dietitians, and so much more. Speak to the other folks in the booth today and learn more about how you can improve your wellness.